everybody to today's webinar on advanced care planning. And this is a topic that we have touched on a number of times before, but it is such an important topic. It bears repeating, and it is something that we can continue to learn about and have a better understanding about. So with that, let's go ahead and get started in advanced care planning. So again, our disclaimer, this presentation is intended for informational and educational purposes only. And while I am a licensed physician, I'm not acting in the capacity as a physician during this presentation. And the content provided should be not construed as medical advice, but just simply educational material. If no patient-doctor relationship is being established, and any and all decisions related to your medical care should be made in consultation with a licensed medical professional. So at Wellspring Healthcare, we believe very strongly in the power of compassion and effective communication to empower lives. And so we put these webinars on in order to try and improve all of our patients' understanding about their healthcare and about decisions that they may need to make in the future. So of course, let's keep in touch. If you are a patient in a nursing facility or in an assisted living and you would like to have us care for you at Wellspring Healthcare, please don't hesitate to reach out to William. And if you're a facility and you'd like to see some more about what we do, please don't hesitate to reach out to us by calling Brandy at 816-708-1658. And of course, you can always reach us on our website at wellspringhealthcare.org. So what is advanced care planning? Advanced care planning is a broad umbrella-based term that allows you as a patient to make decisions about your healthcare. That how would you want to proceed if you're unable to speak on your own behalf? And it requires a great deal of reflection, communication, and then eventually documentation. But it really means, like, what do I want for the rest of my life, and who do I want to speak on my behalf if I'm unable to do so? So some key components of advanced care planning. We're going to reflect on our values and our goals, because this is a unique decision that is unique to each individual person, right? So every person is going to approach this decision slightly differently. That's based upon their own unique goals, values, and opinions. So you have to kind of consider what you would deem appropriate quality of life. You know, I've had some patients when we have this discussion and they say, Dr. Haas, I don't ever want to have a breathing tube down my throat. I don't want that. I don't want someone to pound up and down on top of my chest. And that is a unique situation for each and every person, right? That is something that each person can make on their own. And some people are very much of the mindset, no, I want everything possible done in order to live as long as possible. And so we have to take that time to think about what is important to us, because a lot of the time the nuance comes in the gray area, right? So we can say, I want everything done to make myself as well as possible. But on the other hand, I want things done in a limited capacity, or maybe I want everything done. However, if this, and this happens, then that's not what I would deem or consider to be a high quality of life. So that's where we have to kind of look overall in regards to our aspects of advanced care planning. And sometimes we have to ask questions that maybe we don't really know the answer to. Maybe we've never seen what a full resuscitation measure is. And so we need to kind of discuss that with our primary care provider. And maybe we need to talk to our primary care provider and looking at, from a statistic perspective, what is my chances of recovering or having a meaningful quality of life or having a return to a high level of function? Do I want to be a do not resuscitate? Do I want to maybe have dialysis? Maybe I don't want to have dialysis. Do I want to be the kind of patient that goes to a nursing home with a tracheostomy tube? These are all questions that are unique to each and every individual person. One of the last things here we have is artificial nutrition and hydration, and this can often be a very significant sticking point. Maybe the person had a significant stroke, and after their stroke, they lost the ability to swallow. So their mind is intact, they're able to communicate to a certain degree, but they just can't swallow. That's a decision where someone has to say, do I want to put a feeding tube in? Now, maybe if they're alert, they're awake, they're conversant, they're able to communicate, that would be a situation where, yes, a feeding tube would be very reasonable. But maybe in that person's unique individual situation, they may not want a feeding tube in the event that they're not as high functioning, right? So it's probably unlikely that someone's going to have a stroke that's so isolated that it just affects their ability to swallow. They probably have some level of other problems that are going along with that. And so it's important to take that into consideration as well. So let's talk the next aspect is choosing a healthcare proxy. So this is designating someone that you trust to be able to make a healthcare decision on your own behalf if you become incapacitated. So let's take that example that I just used of someone that had a stroke. So this is an individual that, was alert, awake, talking, running errands, going to the grocery store, doing their normal activities of daily living. And unfortunately, they now have lost the ability to communicate. So decisions have to be made about that person, right? So let's take the instance of the feeding tube that we were just talking about. So this patient had a stroke, and now they, in addition to not being able to swallow, they can't communicate with their healthcare provider. They can't tell their healthcare provider what their ultimate wishes are. And so we're going to look ideally to the first person, which would be your durable power of attorney, someone that you have elected to speak on your behalf. And hopefully you've had a conversation with this person to say, yes, I would want these aggressive measures done. Or if I look the way that I look now, where I can't communicate, I can't eat, and I love to eat, I love to eat a big piece of chocolate cake every now and then. If I can't do that, then I would not want long-term aggressive measures. Or if it's highly likely that I'm going to be bedbound, or I'm going to have to go to a nursing facility, or I'm not going to be able to advance my life in a meaningful way. If the chances are low, then maybe I wouldn't want that feeding tube. And so again, we're going to look to that healthcare proxy, that durable power of attorney who you have appointed. Now, sometimes people don't appoint these individuals, and that makes things somewhat difficult because now we're requiring, we're trying to figure out who that person is. Maybe that's a family member. Maybe that family member has different beliefs than what you have. And so it becomes a little bit sticky, or maybe you haven't had this conversation. And so that person that we're going to ask them about these questions, they don't have the answers and they don't know. And that creates a great deal amount of stress and anxiety for the family member that we're asking. And so choosing and electing a durable power of attorney doesn't just stop with choosing that person. It continues with communicating those wishes with those family members, those friends, or those healthcare providers about your values and about your preferences in terms of what you would want to be done. And I think that it's important to sometimes look at the overarching conversations that you've had. I've had this conversation with my father, for instance, and he often tells me, he says, Brian, if I have trouble taking care of my own basic needs, like going to the bathroom or doing personal hygiene aspects, he says, I want you and your brother to take me camping, and I want to roast some marshmallows, and I want to focus on quality. All right, so that tells me I now know where my dad determines and draws a line in the sand for all intents and purposes in regards to his decision making. And so that helps to guide me in the pathways of what he would want. And I think that we often have these conversations with our own family members, and they can sometimes not be a pointed conversation. Sometimes that pointed conversation is necessary, but sometimes it's based upon what someone has mentioned to you in the past. Sometimes people use the term vegetable, and I'm not a big term of using that because there's so much gray in that area. I think it really comes down to in regards to what do you determine to be a strong quality of life. Some people think the ability to simply communicate is a high quality of life. Other people may say, unless I'm able to go out and, go on a hike or take a walk or be ambulatory or be able to transfer, they would deem that quality of life. And so each person uses their wishes or has different wishes. And so we have to be able to respect those. And so if we are in a situation in which we're incapacitated, having a durable power of attorney that you've appointed, that you've had this discussion with, is extremely valuable. So next, now we've kind of identified what our goals and wishes are. We've identified a durable power of attorney. Now we want to help that power of attorney even more, because when they're in the setting of a stressful environment, they may not remember all of the things that you have talked about. So this is where we document our preferences inside of an advanced directive. And this is where we include a living will, where we put their name for that durable power of attorney. And then maybe we have things such as a do not resuscitate order, or in certain states, they use a physician orders for life-sustaining treatment, a PULSE order. So it's very important to not also include these documented preferences so that they're written down. And sometimes they're signed by a notary, or sometimes they're done by your elder law attorney. So that you can have this packet of information that in the event that something unfortunate happens, you can reach for that document and have it already present. Sometimes it's very important to review these documents from time to time. So if you're someone that was very forward thinking and you put together this plan when you were in your 40s or 50s, now you're getting up into your 60s, 70s, or 80s, or maybe you've had a significant health scare or another problem. This is a situation in which you might want to review and update your plan. You need to make sure that your healthcare powers of attorney are updated. You need to make sure that something hasn't happened to your durable power of attorney. Sometimes it's a good idea to put a secondary person, or maybe you've had a falling out with the person that you would initially put on your durable power of attorney paperwork, and you need to change that durable power of attorney paperwork. Maybe you've had a situation of a divorce, and so your ex-wife or ex-husband is maybe the person that is listed as your durable power of attorney, but now you're remarried. And so that creates a significant, interesting dynamic, because as a healthcare provider, we have to go with the document that says durable power of attorney, because your durable power of attorney is not, that trumps your spouse, for instance. So we have to look to those documents. So it's very important that we refer back to them from time to time. So again, these are some different orders. We need to make sure that we're looking into all of these. And I can't stress to you how important these documents can be. And beyond the documents, again, having the discussion about what your goals in life are, because I promise you don't want to be in the situation where you're in the hospital and your loved one is hooked up to a ventilator, and now you're trying to figure out what that loved one wanted. And I know you as the patient don't want your loved ones to be in that situation either. So what are some benefits of advanced care planning? We have enhanced control. So if I'm talking to any of my control freaks out there, myself included, we want to make sure that we have had these discussions so that we have control over what happens to us when I can't communicate. Again, we've touched on this before. It reduces that burden. It eases the decision-making on family members and friends. It improves our quality of care because we ensure that it aligns with your values and your preferences. And even more so, this gives us peace of mind. Oftentimes it's disconcerting to have these conversations to begin with, but it's having that peace of mind to know that you and your loved ones have your wishes known, they're respected, and we know what everyone wants to do so that everyone can be respected, cared, and loved. So in summary, again, advanced care planning is a extremely vital process that empowers individuals, it supports families, and it enhances the quality of care and ensures that our healthcare decisions align with our personal values and preferences. Extremely important, and I can't stress this enough. So again, let's keep in touch. Please don't hesitate to reach out to William, our medical assistant, at 816-708-1661. And for any facilities, if you're interested in having Wellspring come in and provide services in your building, please don't hesitate to reach out to us or visit us on our website. We're happy to reach out to you and help to provide care for you and your loved ones. We hope that you found some value to this, and we look forward to talking and taking care of you in the future. Bye-bye.